Good afternoon, all. How are you all? I hope you're all well. I hope you're all safe, and I hope you're all doing what you can to get through this unfortunate time at this moment in time. I'm your president, Jimmy Quinn, and I'm very happy to be here to introduce this webinar. A couple of things before we go on in terms of the webinar. I just wanted a moment or so just to mention some of the things that we're doing as a presidential team. And one of those things is the visual impact of our presidential team. You're not only having one vice president here today, but two exceptional vice presidents in this team. You're going to see Dr. Dave Gold, who is becoming a bit of a veteran when it comes to webinars, and he's done a few of these and other webinars in the last year. Also welcome Neil Catton, and I'm sure James will talk about that in a moment. Another one of our new members to the presidential team, and Neil is again going to be supporting David, as David will support Neil. So I hope you will welcome them both on this presentation. And obviously me, as your president, doing a quick intro. A quick moment before we go on, before I introduce James, is that there's a couple of things I just wanted to mention to you all while I have the floor. We're doing a lot of stuff on veterans this year. If you know a veteran, get them involved. If you know a veteran that's a health and safety practitioner, get them involved, and get them involved on LinkedIn as well. We're doing a focus group on that within our council as part of IOSH. We're also going to be doing a group on mental health this time as well, and some of that work will be involving members of our membership as well. And then just another quick one before I move on. PDSAs. I would love to see more of these President Distinguished Service Awards going out to our hardworking volunteers and members of IOSH as well, to show our gratitude to them as part of that award. And also to let you all know that this presidential team is here for the members. That's why you're not only seeing one, but two, and me, and you'll see this in most webinars going forward. That said, thank you so much for your time. Thank you so much for being engaged. I look forward to Dave and Neil's presentation. Over to you, James.
Thank you very much, Jimmy. For those of you who don't know me, my name is James. I am the chairman of IOSH Southwest. A very short introduction for myself, as Jimmy had covered most of the points. This webinar will last approximately 30 minutes. We will have a good 15 minutes to half an hour for Q&A at the end. Please, as a reminder, please take part in the poll. These are very interesting as we go. So without further ado, let me introduce David and Neil, who will immediately take it away. David and Neil, over to you.
Great. Thank you, Jimmy, and thank you, James, for the introduction. It's really appreciated. My name is Dave Gold. Today I'm working with my friend and colleague, Neil Catton. Both of us are vice presidents of IOSH, and we're very pleased to be here with all of you today, trying to outline how IOSH and how occupational safety and health professionals have been responding to this pandemic and laying the foundations for a healthy recovery. I'm going to start my screen share. Dimple, please let me know if for some reason the screen share is not showing. Okay, Neil.
Okay, well, thank you. Don't you just love technology? I'd much rather be in a room talking to you all on a podium, but there you go. It's we are where we are. I'm one of the old guard. I'm not so keen on all of this technology stuff, so there you are. Okay, anyway, thanks David for the introduction, and thank you for the opportunity to be here. First, in case you're new to IOSH, here's an overview of who we are and what we do. The Institution of Occupational Safety and Health, IOSH, is the world's largest membership organisation. It's the only chartered professional body focused on safety, health and well-being in the workplace. With around 47,000 members in 130 countries, we act as a champion, as an advisor, as an advocate and a trainer for safety and health professionals working in organisations of all sizes in most sectors. And our focus is to support our members in their efforts to create workplaces that are safer, healthier and more sustainable for everybody. As well as being a professional body and a membership organisation, we're also a thought leader and an enabler, and we work with organisations around the world to excel in health and safety. The session will see how IOSH and its members and training partners have responded and continue to respond to the ongoing pandemic. I will touch on our coronavirus information resources, how businesses can manage risks associated with second waves, new variants of the virus and local lockdowns, and our calls to key stakeholders such as the IOSH profession, business and policymakers. Organisations have made very significant adjustments to how they work in line with rules, advice and guidance from government. As scientists' understanding of how this virus and its variants spread, and with improved knowledge of clinical risks, IOSH professionals have played essential roles: risk assessing, interpreting advice, and applying appropriate control measures to protect workers, their families, and the communities. As the virus has subsided in certain regions, businesses have also begun planning approaches to returning to the workplace and recovering following the first COVID-19 lockdowns. In many cases, after partial returns to near normality, these plans have had to be paused and new restrictions adopted once again. IOSH has supported these efforts every step of the way. We hope this presentation will help share how organisations have become resilient, IOSH professionals have partnered successfully with colleagues to keep staff safe, workers took responsibility for their own and others' health, and businesses can now apply what they've learned to plan for the future. Through the myriad changes of the COVID-19 pandemic, IOSH has witnessed occupational health and safety professionals making exceptional efforts to help people worldwide deal with and limit harm caused by the coronavirus pandemic. Our profession, more than most, is equipped not only to assess and manage risks and hazards, but also enable recovery from this crisis in a safe, healthy and sustainable way. And I don't know about you, but it makes me very proud. On 16th of March 2020, IOSH began to communicate support for our members. We contacted our training partners to show our support, rapidly working with them to move our courses online. Very quickly, from March onwards, IOSH redirected all its work, researching, writing, designing, communicating, and disseminating advice and guidance to produce content focusing on COVID-19 material. We created a knowledge hub at iosh.com/coronavirus that continues to grow as the pandemic response changes. This helped with workplace hygiene and preventative measures. We then supported managers and staff with adapting rapidly to healthy remote working, based in part on previous IOSH-funded research, as well as ergonomics of working at home and working from home mental health. Next, we initiated a Returning Safely campaign last summer to help employers plan and implement their way out of lockdown. Now we're offering advice on all aspects, covering how to prevent infection, spreading, and how to make all COVID workplaces secure, looking after people and well-being, including mental health and wellness. So far, we've had over 230,000 views of our coronavirus web pages, and far greater engagement than ever across all our social media channels, where we share news and information about the guidance, such as with you, CIPM. At the start of April 2020, we ran our first of our new very popular series of free weekly COVID-19 webinars, partnering for this first session with the World Health Organization. Over 5,000 people registered for this, and the webinars have developed into a popular, insightful strand, attracting thousands of participants and representatives from many organisations. The purpose of the series was to support IOSH professionals, industry sectors and businesses at an unprecedented time. And so far, we've had speakers from, as mentioned, the World Health Organization, UN Food and Agriculture, Chartered Institute of Personnel and Development, the Chartered Management Institute, and Make UK, as well as hospitals in China, Italy, heads of safety and health for health services, insurers, supermarkets, shipping and logistics, and many, many more. So far, attendance across almost 30 COVID-19 webinars has totaled over 22,000 people. IOSH volunteers running many complimentary online sessions such as this one has engaged over 150,000 people in more than 100 countries during the pandemic. We've been able to offer guidance on office returns, mental health, resilience, effects on supply chains, the strains on the health sector, and the issues facing the travel sector, amongst other areas of importance. We're grateful if you participated. Thank you very much. Most webinars have been recorded, so if you've missed them so far, I recommend that you visit the IOSH COVID-19 web pages, check out the content and view the particular topics of interest. Alongside this, we've communicated widely with all of our audiences and partners, audiences through social media and traditional media, and to share advice on how businesses should support COVID prevention, plan to work and work with businesses to embrace the role of IOSH professionals and colleagues to respond to emerging risks. IOSH Media Relations gained coverage with all of our call to governments and to business to put health and safety first, to avoid work environments becoming places of transmission for the disease. IOSH has invested exceptional efforts in improving services for members, so we offer our full service under remote conditions. We continue to enhance online support and encourage the IOSH community spirit of sharing of knowledge and mutual support. Using technology available to us, we've accelerated the launch of our mentoring platform and careers hub for members. And we recognise that additional support for members is absolutely critical at this time. To offer additional support to health and social care workers, we cooperated with the Faculty of Occupational Health Nurses, distribute their relevant content via our network. We've been supporting healthcare workers in everybody's global interest. We've collaborated with the Institute of Directors, Chartered Institute of Personnel and Development, and other partners in the UK. We're already raising the profile of the IOSH profession and IOSH within the business community, while providing credible knowledge, insight to their audiences to enable success, prevention, business continuity, resilience, and as organisations move through phases of redeployment into recovery. We look forward to working with you all to achieve this. We also ran 2 global surveys for the World Health Organization to capture intelligence about what prevention and control methods work most effectively for key workers and health and social care workers. Data from these was analysed to inform updates and to improve improvements to global audience participation and guidance. So hopefully that's a good starter. I'm going to hand over to David now to continue the seminar.
Thank you, Neil. I'd like to go a little bit more technical. I appreciate this general introduction that Neil has put together. And obviously with 316 participants on this webinar, I think it really shows that there is a need and a thirst for up-to-date information about recovering safely as far as this pandemic is concerned. A few introductory remarks. When organizations that paused activities or moved to remote working for weeks when this pandemic began, we started to look at, as we move through this, returns to the workplace. And IOSH launched a new phase of advice and guidance, which was focused on the idea of returning safely. You can actually access that if you want to see it at the IOSH website, www.iosh.com/returning safely. But then as this winter progressed, we've seen things change. We've seen in 2021 that there are new things emerging. So we're now focusing on something a little bit different, a little bit more up to date. We're kind of modifying things and trying to keep things up to date as an institution as we go. And now we're focusing on making work COVID secure as far as reasonably practicable. We advocate competent, thorough risk assessment as a starting point. And I'm going to talk about this a little bit later. So we need to do this when determining how people can work in a COVID secure situation. Healthy ways, either in their customary workplace or wherever they might need to work remotely. Now, to do this effectively, we also need to have trustworthy medical information so that we have the background necessary to perform appropriate risk assessments. And we work with sources such as the European Centers for Disease Control, the US Centers for Disease Control, the WHO, the ILO, and other organizations. And IOSH's online coronavirus advice hub and its resources helps us navigate a safe path with guidance in 4 specific areas, which I will also cover in more detail: safe people, safe workplaces, safe systems of work, and safe equipment. There's also a series of free e-learning modules available to you that you can find on the IOSH website. From the IOSH perspective, at the same time we work on all of this, we need to set our policy position. And that will no doubt resonate with all of you on this particular call, on this particular session. And what we're saying firmly, and what the presidential team representing IOSH, what council, what all of us believe in IOSH, is health and safety must come first when considering restarting or continuing work during the COVID-19 outbreak, protecting workers and communities, and enhancing engagement and productivity. For many organizations, in fact, for all organizations, this is a systematic plan, do, check, act approach. It's a safety and health management approach. And forward-thinking organizations have already looked at resilience and trying to find ways to move ahead effectively, safely, and cautiously. There needs to be, and I can't underscore this enough, a planned risk control approach based on leadership, based on worker involvement, based on safe systems of work, and sound, safe, and healthy advice. We also need to have in place cross-functional teams who should assess these risks for COVID-19 security and general health and safety and ensure action before the workers return. Linked to this and underpinning all of this are applicable legislation. Now, we are a global institution. We have members, as Neil pointed out a few minutes ago, across the globe. It's not just British or Irish safety and health legislation or European safety and health legislation. There's all kinds of safety and health legislation. So we need to adhere to an applicable national COVID-19 security policy and guidance, including safe travel and conducting inspections and assessment of all relevant areas to ensure there's been no deterioration of health and safety standards during the lockdown. Employers need to take action to ensure safe people, workplaces, systems, and equipment. I'd like to talk a little bit, as I mentioned to you before, about risk assessment. But I also want to call your attention to a 3-page document that IOSH has published. It is also on the website. You can see the website link in front of you that talks about our resources pages looking at risk assessment during the pandemic. So the measures you choose to implement need to be, should be, actually must be bound, dependent on the outcome of your risk assessment. As safety and health professionals, we do risk assessment all the time to determine control measures to deal with risks that we identify. Well, we need to do the same thing with COVID-19. Governments increasingly require organizations to complete risk assessments as part of the permission to resume normal work. So this guide, which the slide addresses or the slide focuses on, basically looks at a separate risk assessment for COVID-19. However, it's equally valid to amend existing risk assessment methodologies by the activities that are promoted or actually developed in this guide. The other thing that's important, obviously, all of you probably come from different professional backgrounds or different organizations, different industries. And risk assessment covering exposure to COVID-19 will be different from one organization to another. Healthcare workers, retail workers, cashiers, home delivery drivers, utility engineers, construction workers, all have different exposure to risks, the risks of COVID-19. So the purpose of this downloadable guide is therefore to pose questions that need to be asked so the appropriate risk assessments can be created in all industries. Let's take a look in more detail at the 4 areas I outlined earlier. That is, in establishing COVID secure work: people, workplaces, equipment, and systems. When it comes to safe people, we advise you to, number 1, assess COVID-19 related risks, just as I mentioned a few minutes ago, and protect all workers, including, and perhaps most importantly, the vulnerable worker. Secondly, ensure that only those workers who cannot work from home and can safely return to work do so. Thirdly, regarding people, we need to provide adequate training, consultation, communications, and awareness, which with a means for workers to raise concerns. We also need to support ergonomics and well-being from home workers. When we did some seminars in Africa recently, and we were talking about homework and people working from home, for example, in Nigeria, it was not surprising, but an eye-opener to know that many, many people in Africa, many people in various parts of the world have never worked from home, have never considered the ramifications of working from home. And there's certain difficulties, certain challenges that people must need to face. And how do they deal with their families? How do they deal with their pets? How do they deal with their extended families? How do they deal with hours? And how do they deal with the other type of work that's associated with it? All of these things need to be taken into account, and we need to assist people in working through that. Let's take a look in more detail. Let's take a look at more detail on the idea of the safe workplace. Many of you have heard what I'm about to say, so this may be a little bit redundant or repetitive, but I think it's worth repeating. We need to focus continually on providing physical distancing. There should be signage, there should be distance markers, there should be barriers and one-way systems. There should be perhaps staggered start, finish, and break times to reduce numbers of people that are together at any given time. We need to also focus on improving hygiene. Do we have adequate washing facilities? Do we have adequate hand sanitizers? Are we regularly cleaning surfaces? And are we regularly dealing with disposal services? Are we supporting the appropriate use of face coverings for reducing the spread to others? We know that it's a measure that sometimes has a little bit of discussion attached to it, but we also have to at the same time be very aware that there are some medical exceptions for people who cannot wear face coverings. And this matter needs to be handled by safety and health professionals in consultation with HR. If no control measures can be implemented to protect the employee or their colleagues. We also know for a safe workplace, we need to have improved ventilation arrangements. We need to redesign processes to reduce risks, including, for example, retaining telework. And if you think about it, and as many of you know, part of my background is fire safety, even the issue of evacuating people to a fire assembly point needs to be looked at again, because we can't necessarily group and line up people. So how do we deal with fire assembly points? Let's look at safe equipment. We need to provide the necessary personal protective equipment and safe use guidance. We need also to check on the plant. We need to check heating. We need to check ventilation, lighting, and hygiene arrangements. And we need to think, when a plant shuts down, how do we safely recommission it? The plant, the equipment, and the statutory inspections. We also should never, at the same time, let normal safety and health concerns slip. regarding the, we need to think that sometimes there may be moves to say, okay, we don't need to do that right now because we're in the middle of a coronavirus crisis. We need to continually be aware of occupational safety and health and the related systems. So IOSH is recommending to employers and their workforces to review, update, and communicate all risks in the light of COVID-19 requirements, to ensure that workers who are symptomatic know they shouldn't be at work, and anyone who develops symptoms is isolated and sent home. We need to ensure that employee testing may be required and or necessary. And this is complex, so we need to seek medical as well as human relations information and advice. We need to continually check that fire safety, first aid, water, and asbestos management arrangements are ongoing. We need to offer ongoing mental health support and flexibility for work-life balance issues. And as Jimmy mentioned to you earlier, Council has a special focus group that is dealing with mental health, and this is a very important issue. The interrelationship of psychosocial issues, the comorbidity of psychosocial issues during this pandemic. And we need to ensure that statutory inspections happen, especially if the workforce or the workplace has been vacant for a long period of time. Many members of IOSH Council, many members of IOSH have started to express concerns that we need to, even before the pandemic, that we need to focus on well-being. And as you know, mental health and well-being is part of the foundational vision of 2022 as an area of focus. And this needs to be, this is even more important as we start talking about this pandemic. The well-being of the workforce, the importance of work-life balance is something that organizations globally are prioritizing as pressure continues to mount on people and their families affected by the tragedy, loneliness, and other negative impacts, including job insecurity. There are a number of things organizations can do. One is to communicate the organizational plan by being open and honest with all workers and ensure clarity. For this, good leadership is absolutely imperative. We need to keep in regular contact with remote workers. Being isolated, being away from social support is a serious stress factor and creates a certain degree of loneliness for those unable to return to work immediately. We need to help the workforce set boundaries for working hours. We need to allow workers to disengage from work when they're required to, or introduce reduced working areas to begin with. We need to encourage workers to discuss amongst themselves, but also at various levels, well-being and mental health, and adopt an approach to provide positive morale-boosting messages and positive information for workers. The issue of positive reinforcement is also extremely important. It was extremely important before the pandemic. It's equally or more important now that we continue to motivate workers through praise. So let's continue on this idea of well-being. Okay, well-being plays a really critical role in an employee's mindset and actions. So we need to offer general well-being information. We need to offer messages. We need to highlight sources of information. We need to encourage healthy sleeping. We know that a lack of adequate sleep is a stressor. So we want workers to get helpful quality sleep. We want to encourage workers to stand regularly. I see pictures of workers working from their couches or their beds in different postures, and many of them may stay at their computer for hours. And we know that there is a benefit for them to stand every hour and to just get a little bit of exercise and just stretch a little bit. One of the things that becomes critically important is to try to encourage socially distanced physical activities. I try to get out at least every other day for a 5-kilometer walk, even though I am in isolation where I'm sitting right now. And this helps clear my mind, but it's very good from a mental health perspective, but it's also keeping me healthy at the same time. The idea of eating nutritious foods, I know that there is a lot of weight gain during the pandemic. And the healthier diet obviously can help fight off the infection and raise overall health issues or levels. One of the things that have been suggested is to encourage workers to partake in controlled breathing exercises. And this also helps reduce stress levels. And also good standards of hygiene. Not only is it the hygiene of just normal hygiene, but also the idea of maintaining hygiene of working equipment, wiping keyboards with cleaning products, and ensure workers follow any new cleaning procedures and regimes. And another thing that becomes important, again, in the encouragement of well-being, is during this very demanding time, employees and line managers can provide varied tasks if possible to break up the routine, so to speak, that someone's not doing the same job all of the time, and to allow a certain degree of flexibility, to allow one's mind to work in different directions, okay? And to ensure that work deadlines and time scales are reasonable. This will also help considerably to reduce stress. I mentioned earlier this issue of legal qualifications. We need to stay up to date with local COVID legislation, which includes the OSH management system, duties and obligations and workers' rights, and provides a basis for OSH principles. So it's important to stay up to date, to consult your local and national public health authorities and other sources. And there is a guide on the Irish coronavirus website on returning safely. There's a guide on legal obligations. Neil, if I'm not sure you're unmuted, but Neil, there is something that you're going to be organizing in February. Could you tell us about it?
Yeah, I certainly can. And sorry about people not having particularly hearing me particularly well. Signal issues, but it might well be a bonus, to be honest. But there you go. You may be interested in signing up for our next Caring Through COVID webinar on Thursday, the 11th of February from 12:30 to 13:30 GMT. It will be delivered in partnership with the Law Society, entitled "The Law is in Lockdown, Workplace Rights, Obligations," and you're very lucky it will be chaired by me. Thank you, David.
Thanks, Neil. Now, let's talk a little bit frankly. Something that I think all of us, even maybe we admit it, maybe we don't, maybe we think we're tough, maybe we think we're superheroes, whatever it may be, but we're living and working alongside a virus that spreads, it subsides, it spikes, and it hits in unexpected ways in certain populations. It exploits weaknesses in controls and safeguards, weaknesses sometimes and human behaviors at home and at work, where people after a while may become complacent, they may become lax, and this virus tends to slip through. Now in places where the infection rate and the reproduction rate, which is known as the R number, they may be declining in recent months, but latest data show COVID-19 cases are again resurging. You just have to pick up the newspaper. There are new strains coming from various parts of the world, such as the South African strain or the Brazilian strain, that have made COVID spread even more effectively than it did last time around. We're seeing different restrictions, resurfacing restrictions on travel, movements, size of gatherings, and what venues and businesses can operate. And some of these restrictions are being extended or introduced. So when the risks subside and these restrictions are relaxed, they can be imposed again, as happened recently in the UK, without much warning when case numbers begin to rise. What's essential for us as safety and health professionals, what's essential for human beings, is to be vigilant, to be agile, to be disciplined, and how we plan for and we implement not only our workplace controls, but our own personal controls as far as dealing with the virus. You all know the systematic plan, do, check, act approach, which is a planned, risk-controlled approach based on strong leadership, worker involvement, and sound safety and health advice. This is something we should be focusing on. On the IOSH coronavirus information pages, we've collected information that can help you tackle some of these uncertainties, including a COVID webinar in the autumn called Managing Your Safety Through Local Lockdown. You can find these recordings on the IOSH website, and panelists from different sectors, including construction and consultancy, as well as a regional business network whose places have been affected by local lockdowns and share their experiences. There seems to be good news on the horizon, and that is that in 2021, we're in a bit of a more positive situation. Humans know much more about this virus, this pandemic now, and scientists have developed an effective vaccine at record speeds that have not been known before. And while not everyone is able to have the vaccines, with health factors needing to be considered, great effort is underway to roll out these vaccines as far and as fast as possible to try to make immunity widespread. IOSH strongly encourages employers during this period of time, during this time when we're finding this good news and we're vaccinating people, but the virus is still there. So we need to be diligent about assessing and managing all COVID-19 risks and ensure safe work using a systematic approach, the hierarchy of control, and excellent communications. We need to encourage employers, and we need to show strong, clear leadership and effective line management and focus on worker engagement. It's critical we protect vulnerable groups and those at higher risk of serious illnesses, such as workers with underlying health problems. We need to provide ongoing physical and mental health support, recognizing that some effects may be long-lasting, and consider the needs of all workers, including those on the front line, those with health conditions, those working from home, and those furloughed. We need to extend your risk management into your supply chains, ensuring those who are self-employed or work in the informal economy are also supported to stay safe and to stay healthy. To find out more about our advice and guidance on COVID-19, you can do any of the things that are showing on this slide. We're constantly updating the guidance at IOSH and collating resources from other authoritative sources. We are all rising to the challenge of this global pandemic, but there is a long way to go. Let's tackle it together. I think a number of you probably know my background. I'm a former firefighter paramedic in the United States many, many years ago. And dealing with infectious disease was something that was part of our emergency medical paramedic training. But even with a limited understanding of communicable diseases and viruses, I don't think any of us have ever thought that something like this could happen and could have the impact that it's having on people today around the world. But we know we have to be diligent in fighting complacency. We need to get messaging across that encourages people to do the right thing to stop the flow of this virus. And I'm very proud that our institution, the Institution of Occupational Safety and Health, that Jimmy serves as a president. My colleague Neil is working closely with me on the vice presidential team, along with other vice presidents, the administration of IOSH, and members of council and others. We all continue to work in a variety of different ways, but the beauty is that we're working together and we're all trying to work against this common enemy, which is taking countless lives, which is COVID-19. Ladies and gentlemen, I want to thank you for your patience. We're going to go to questions and answers. one last thought I have, and I know Neil joins me in please encouraging you to stay safe, stay healthy, stay well. And at this point, we'll be happy to take any questions.
Oh, thank you, David, and thank you, Neil, as well, for that fascinating presentation. For those of you who are listening who haven't already, you now have the opportunity to ask any questions in the Q&A box. And David, Neil, I can see there's a number of questions already popping up already, quite COVID specific. So whilst we're waiting for the rest of to populate, I will start you off. Firstly, are IOSH working with the public health authorities? Do IOSH have a view on lateral flow tests where employees are being asked to do lateral flow tests in order that they can come to work? Isn't it reasonable for employees to ask their employees to conduct lateral flow tests? Great question.
Okay. It's a very interesting question, and one of the, it's in a sense difficult to answer because we're talking about IOSH from an international or a global perspective. And the easy cop-out, but I'm not sure there's an easy way to answer the question, is to say that we need to look at what national authorities are recommending as far as dealing with this pandemic is concerned. So I think you need to go not only nationally, but even locally. Because I know we have probably people on this call from different parts of not only the world, but also different parts of the UK. And what's going on in Scotland might be different from what's going on in Wales, which might be different what's going on in Ireland and in England. So please check locally about this. I do not have a statement from IOSH that is looking at lateral flow tests, but I think that's the best advice I can give you at this point. I don't know if you have a different perspective, Neil, on this question.
No, not at all, David. Thank you. I think you answered it as best we can. We don't have a IOSH statement as such, so concur with what you've just said.
Okay. Yeah, some of the questions are quite specific. Another one here on somebody trying to understand the boundaries of home working. Where do the employabilities start and stop, for the exception of someone who's home working injures themselves in the kitchen while preparing their lunch during working hours? There's complexity, there's an ambiguity as to where the employer's duties start and stop. Is there any IOSH guidance on this?
Neil, do you want to give it a try, or do you want me to?
There is a published IOSH guide on home working available on the website.
Okay, that really leads into the next question. As a reminder, where can members find the free online learning for IOSH? I think some people missed that particular part out.
Yeah, I think the website's had a major overhaul recently, and there's a load of good stuff on there. But the previous question, certainly, I know there is a home working guide available. So with some links and to extra help. So that's all there. Go there. There's a mine of information available. And
one of the questions, sorry,
go on, David.
One of the questions that have come up during some of the previous webinars, and I think it's very interesting, is, and this is a moving target, so it's again something it's difficult to answer. We don't have years and years of experience with this, but there are issues, for example, of workers' compensation. I think the question about working at home and what happens at home, for example, if someone is preparing lunch, is that part of work or not part of work? And I think in various parts of the world, the workers' compensation laws are basically give some framework to where things are as far as working from home is concerned. So we do have a publication on working from home. We do have some guidance that you just alluded to, but at the same time, I implore you to look at your local and national rules, regulations, compensation structure, how all of this works.
Okay, great. Thank you, David. One more question here from Jim is how would IOSH address the negative comments that are spreading around workplaces on getting the vaccine? Do we have an issue on those negative anti-vaccine comments?
Well, I can speak personally from my own background as an emergency paramedic, my own background in occupational health. As soon as my number is called that I can roll up my sleeve and get a vaccine, I am there. I am going there. I will get that jab. I will encourage my wife to get that jab. And I'm not going to jump on an airplane. I'm not going to jump in public transportation until I have that vaccine. So I am, if I dare say so, James, I am biased because, well, my grandfather died in the flu pandemic in the 1920s. My namesake died in a flu pandemic in the 1940s. Vaccines are a very effective and very, very powerful way of doing it. Are we 100% sure that this vaccine will have no side effects? Are we 100% sure this vaccine will be 100% effective all the time? No. It is, again, a moving target. I think professionals in public health are dealing with this around the world and see that this is the best option for us to develop what is known as herd immunity, whether it be 70 or 80 or 90%, is the best way of killing and controlling this virus to get there. Do I have patience for people that say, I don't want to get a vaccine? It's people's right not to get the jab in the arm as far as vaccine is concerned. But at the same time, one has to figure the rights of the, I don't want to say herd, but let's say the rights of the crowd. And I think I want to see you and I want to see me protected as much as possible. There are people, Switzerland has a very, very strong anti-vaccine, where I live, has a very, very strong anti-vaccine perspective. There are people that don't want to get vaccinated for the flu shot and other things, but we're seeing these numbers of people that object to vaccine come down in light of the COVID virus because it's shown scientifically as the most effective tool. James, I'm not sure that's the answer that the person wanted to hear, but that's my view, personally and professionally.
No, that's fantastic, David. Another question here in a similar line that the UK is doing very well in managing the risk in vaccinating its people, but the death rate is still high. Are there any new measures, any new avenues that IOSH are considering to address a death from the coronavirus going forward as our deaths are still high? Is there anything new that IOSH or the government is considering to growth areas and also help in mitigation?
Neil, you comfortable taking a stab at this one? I'm happy to add to it after.
I'm not aware of anything beyond what David's extensively explained in his presentation at the moment. No. David, are you?
Yeah, what I'd like to just go back exactly what you're saying. You know, what my friend just said is that we have extensive. We're sharing with you the guidance that we have. And if I was you, I would go online and download this 3-page risk assessment guidance, because we think about any workplace hazard, any risk, any workplace risk that we have calculated. We have tools to try to determine what the control measure is that we're going to put in place. And IOSH is proposing, based on the current science, certain control measures. And these are the measures we should be following. And as an institution, we are monitoring, the Institution of Occupational Safety and Health are monitoring different sites and trying to get background information from different people to continue to strengthen this guidance to deal with these risks. Do we have a magic bullet? Do we have a magic formula? No. But what we can do is depend on the current science to be as strong as possible, to be able to assess these risks, put control measures in place, and deal with it to the best of our ability. I think in the UK, I'm very pleased, where I come from originally, you can tell by my accent, I'm American. Where I come from originally, we believe in common law. And in common law in the UK, which the American common law is based on, we have, if I understand correctly, this thing called a reasonable man. I prefer to call it the reasonable person standard. Okay, and I think what IOSH is putting forward is we can't be perfect all the time, but we can do what we can is reasonable based on the science that we have at the given period of time. And I think that's where we are right now. I hope that answers the question.
Yeah, thanks very much, David. Another question from Roberts. Does IOSH foresee there might be a big rise in claims, I guess this would be civil claims, for people who believe they have contracted COVID at work? And I guess the question is, how can we mitigate this?
Well, I'll come in on that. So I'm not aware of particularly an IOSH position, but I can give you my view. My view is I think there will be some. Proving liability is going to be tough. What do? You continue with all the controls and guidance, and if you are implementing everything that is available to you in terms of the current guidance, that especially we've outlined again today, then surely the defence is as strong as it possibly can be. We tackle this head on the front foot as we do with any other risk. Put the controls in place and manage going forward. And if we do that, any defence should be in a strong position. But do I see a rise in claims? I think there'll be a lot of fallout from this, don't you? Including probably a rise in claims. But that's, as I say, it's not an IOSH view, that's a personal view.
You know, the idea of a claim against an employer or against an organization or against an institution, there are obviously things that are frivolous. This is my opinion now, but there are obviously things that are frivolous. But sometimes there has been a lapse of judgment of someone in authority, or sometimes people don't believe in certain things, they don't put certain things in place. And when people do put a complaint forward, they may be putting a complaint forward legitimately that something has not been done that has resulted in a certain situation. And could there be a rise in this as a result of COVID-19 because of either lapses in judgment, omission or commission with certain people? People are human. Again, the more we can base our decisions in the workplace as the Institution of Occupational Safety and Health as guidance on science, the more we're back to this idea of the reasonable person doing everything they can. And I think that's the best defense that we have, that an organization has against this idea of frivolous complaints, if we're talking about frivolous complaints.
Okay, thank you, David. Just one from Gillian here on the home worker question. She's just looking at the IOSH guidance on home workers, and she says it's not very clear on the boundaries for reporting near misses and where the responsibilities lies. Would IOSH be able to sort of grow in its ideas on that earlier question? Would it be able to offer more guidance for assessing home workers and employers' responsibilities?
I think what I would say is we constantly look at these guides to look to update them and accumulate new knowledge and learning as we go along. I wouldn't think we would turn away the opportunity to look at anything that can improve guidance.
Let me step out of my role for a second, Vice President, and mention that last year, in the middle of last year, I was, as a chartered fellow of IOSH, I offered a series of invitational seminars to look at various issues. And one of the recommendations that came out of these seminars, and that actually was something that was considered by council in looking for the future, is a revision of the homework guidance. And trying to, and again, this is something we are experiencing homework, working from home or teleworking very, very differently than perhaps it was a year ago, before the pandemic struck. So again, it's a moving target, but it's a moving target that IOSH administration and the policy and development people of IOSH are very much aware of. And I would sincerely hope, I sincerely believe that they're working towards strengthening the guidance that there is in homework. Because I think what's going to happen in the future, James, is that homework is going to become more, even when the pandemic is past, and hopefully that's going to be sooner rather than later. I would sincerely think that the idea of using Zoom platforms and Teams platforms and people working different hours, the world of work has changed. And working from home has certainly become part of the new world of work. Perhaps not to the level it is today, but I think it's probably.
Sure. Thank you, David. So with, I think, about 2 minutes left to this webinar, I obviously have to thank all of you, Neil, David. I'm not sure if Jimmy's still on the line, but with just over 1 minute left, are there any closing comments from any of you two before we bring this to an end?
Neil, why don't you go ahead first?
Yeah, certainly from me. So certainly hope that the content today has been helpful to you all. There was an awful lot of information in both sections that we shared with you. So it should hopefully have given you a really good update on where we are. I just want to wish you all the very best and keep yourselves safe. And I'm getting the vaccine.
Yes, and I will mirror my friend Neil's comments and say exactly the same thing. And I please be assured that the presidential team and council and all the different elements of IOSH branches and groups are all looking with a not only a critical eye, but a supportive eye of what we can do to move forward in a positive and constructive way. You know, perhaps leaving some of our differences behind, perhaps, you know, and saying people are dying, we need to work very, very carefully to make sure that we minimize or eliminate these deaths due to this thing. And I implore you all to continue to work to strengthen ways to mitigate and eventually prevent this disease. Our institution has never known the importance, perhaps, safety and health safety and health in general has never known its importance as much as it's known today. We are playing a key role in the world. We're playing a key role in keeping people alive. And I think this is a momentum that we need to sustain. So stay healthy, stay safe. I'm going to take a risk and say, get vaccinated. And hopefully we'll meet up with all of you on the other side of this virus.
Okay then, apologies to those questions that we never got to, but David, Neil, Jimmy, thank you all. And those who joined us for the webinar today, thank you very much. We just ran 1 minute over. So thank you all once again for attending the webinar, and a good afternoon to you all.